Hello everyone, this is Karine Rayson from the Crew Coach on the Wellbeing Project. This week I'm interviewing Samantha Morris. Samantha is very involved in the mental health space and she has a great passion in terms of serving crew and taking care of their well-being. Samantha, welcome.
Thank you for inviting me to the show, Karine.
My pleasure. So Samantha, I think I would first like to ask you whether you have experienced any mental health issues.
Well, in January, I studied for the mental health first aider course, which allowed me, when I came back on board, allowed me to realise what I'd been going through in the last 2.5 years, with my own battles with stress and anxiety, and to identify what's happening in the body and be able to prevent it to happen before it actually happens. So a few years ago, like, I fainted on the job, and I was taken to hospital, and after being in hospital all night, there was nothing emergency like wrong with the statistics that they performed. This contract, I felt the same kind of feeling, but because I had the training before, I knew what was happening to my body, so I had the opportunity to ask for help before I burnt out.
Thank you for having the courage to share that with us. I think it's so important to normalize it, because I know that you're not the only one. So many other crew have these feelings, and I think we need to take responsibility, not only as crew members, but as a yachting industry, to take better care of the well-being of our crew. Now, sometimes crew arrive on board with a pre-existing issue that they have the skills, hopefully, to manage themselves, or alternatively, something could happen on board, whether it's an injury, whether it's poor leadership, or whether it is a conflict or a unhealthy working environment that could trigger the onset of a mental health issue. The common ones are anxiety and depression. So, Samantha, what do you think needs to be put into place in order to take better care of our crew? I know you mentioned mental health first aid training, which I think should be mandatory and part of the STCW 95. But what do you think as individuals can we do to take responsibility of not only our own mental health, but the well-being of others?
Some of the self-help things that I do, obviously, when I'm on board, sometimes it gets pushed to the side because of the work demand. It becomes more so than obviously if you're on vacation. I do some meditation, some yoga. I have a therapist that I speak to at home, and she allows me to put things into a bigger perspective. So instead of just seeing what's in my and listening to the inner critic in my own mind, she makes me see the whole round picture, so I could step outside and look from somebody else's point of view. This was the best money well spent a couple of years ago, to start investing in myself. And as for like your crew, you can always ask them if they're feeling okay, if they would like to talk about anything. Crew, naturally, they come to me naturally and must see me as like protection. They feel that they can come to speak to me without a judgmental ear, and I won't tell anybody. Obviously, if things were severe, like if somebody mentioned like suicidal thoughts, obviously I need to inform the doctor and captain on board.
Yeah, absolutely. And I think you're highlighting some really key leadership skills there. and that is active listening. And active listening is very different to just listening. It's an ability to hear deeply, to put yourself in someone else's shoes, to understand what's going on, and to reflect back what you're hearing so that they feel heard. And the other one that you mentioned is non-judgment. And that is a very, very hard one to practice. And yeah, just thinking back, my experience working in a prison and being their counselor and providing group therapy, hearing the atrocities and the crimes that they committed, I think it is challenging, to put aside your own biases and to be very present with the person that you're talking to. So how I managed that was, I chose not to read the criminal history and just see the person for who they are today, not for who they were yesterday. And that really helped me be present with that individual. And the other thing I think I'll go to is to provide other people with advice. And often that the person who is struggling with the distressing feeling, they're not looking for advice. They're just looking for someone to be with them in this uncomfortable feeling so that they don't feel alone. And it can be very, very isolating. So I think the ability to be non-judgmental, present, listening is pivotal when it comes to taking care of the well-being of crew.
Yeah, and as you mentioned, it is very difficult sometimes because, especially on my own journey, I know how far I've come, and self improvement in the last couple of years. And so it is difficult not to say, but this worked for me, and maybe it'll work for you, because one thing that may work for me, like EFT therapy, may not work for somebody else. They might respond better to cognitive therapy or something completely different, and it is difficult to be in that position sometimes, to you want to say to this person, like, this helped me, so may help you as well, but they just want you to listen. And you'll find sometimes later on they will come back to you, maybe a few days later, a couple of weeks later, and they'll say, what was that podcast you suggested I listen to, or who was that therapist that you spoke to? And when they've decided to come to it with their own terms, and not that you've forced it upon them.
Absolutely. And my other question to you, Samantha, is how would you talk to those who are resisting seeking help, even though it's quite apparent that they need help? So asking for help can often be seen as a weakness, where it really isn't. It's an act of courage. So how would you talk to someone who is resisting seeking help?
We're very fortunate at the moment. We have a doctor on board, so I've offered with one crew member to go to the doctor with them, and they can explain how they're feeling to the doctor. And if they want somebody there, I'm able to go with them. So just to offer like the support. Yeah, so like I say, it's difficult to push upon somebody. And also to sometimes, obviously sometimes the captain, like I said, if it's really critical, the captain should know, because he needs to know what's going on board his boat, which is a bit difficult sometimes because you don't want to break the confidentiality of the crew member, but at the same time the captain needs to be aware. So I try to encourage them to speak with the doctor.
Yes, and that's a good point, confidentiality. So I think if someone is more inclined, or if you find more people are, and Samantha, like I experienced that on board as well. A lot of crew came to me with regards to their personal challenges and difficulties. And it's not one for us to share that amongst the crew, because it's going to make that person feel even more unsafe and overwhelmed. And I think when they're engaged in a conversation with you, as you would know through counseling sessions, as therapists, we have to say at the start of a session that if you are at risk of hurting yourself or hurting someone else, we have a duty of care and we need to report it. So having those clear boundaries put into place as well can help that person feel safe. So,
and I also went to the doctor to speak about say this crew member, to ask him for help, like for pamphlets, for more information on this disorder, and that he could print them off and I could take them in an envelope and give to the crew member to read for themselves.
That's a great idea. And information is so important because, again, it's another action that can make someone feel safe. And the right information as well, because we know what it's like when we put something in Google and then we get all these different answers and we're like trying to self-diagnose, and it makes us even feel even more anxious. Samantha, last question. In terms of when you're struggling with a mental health issue and the environment is very toxic on board, and I know a lot of crews like struggle with this, to make the decision whether to stay or whether to leave, how would one go through the process of making that decision from your personal experience?
It's very tough, and takes a lot of back and forward. I think maybe in your mind, maybe it's easy if you write it down, the good points, the bad points. But over the last couple of years, I've been in hospital a couple of times for some various procedures to determine what the pain inside my lower left stomach was. I've had lots of gastroenterologist tests, and they found nothing. And in the end, GP told me that this is because of irritable bowel syndrome, which can be brought on by anxiety and stress. And your body is sending you all these signals in terms of pain to tell you, to highlight to your brain that this environment is not the best suited for you. Most recently, my body goes in this fight and flight mode where all my muscles feel tense, and this is what happens just before I feel like I'm going to burn out or faint. I cannot sleep properly, so I'm fatigued and lethargic, anxious, and like agitated, like more not as patient as I've been before. I would snap, like someone say something to me, I would like back at them, and it changes the person that you originally are. Like, I'm normally positive, very outgoing, always laughing, always smiling. Your body is telling you that it's time to move on. So you either ignore them and carry on and proceed because you think it's worth to stay around for your bonus, or you take a step in courage and a leap to the unknown, where you decide to leave because health is more important than money. If you don't have my health, I've heard people have had strokes and things from stress and anxiety, and if you don't have your health, what use is the money?
Absolutely. And I can totally relate, because I know that I actually also suffer from irritable bowel syndrome when working on board, and it was a long time ago, like 10 years ago, so I can't remember exactly what was happening, but I shared a cabin with the chef, and I remember being in the crew mess with her having a conversation, and she fell asleep in the middle of the conversation. She was that exhausted. So burnout is a real thing, and it's important to be aware of the warning signs. And what Samantha is referring to is the physiological warning signs, it's the behavioral warning signs, it's the emotional warning signs. So there's a lot there that you can be aware of to better prepare yourself to manage for any mental health issues that may arise. Mm.
Yeah. Is when you don't know what's going on. Like before I did the training and you don't really know what's going on. You just think it's because you've not eaten properly, you've not slept properly. So you think that once you get one night's sleep, this will change. But it's like an add-on effect.
Yeah, absolutely. On Thursday, this Thursday, we're doing a webinar, and it's focused on psychological safety at sea. And we're going to look at the 4 stages of psychological safety at sea. We're going to do a toxic culture audit. We're going to talk about behaviors that you can engage in to create a happy and safe environment. And half of those proceeds are going to Samantha's foundation. And Samantha is going to share a little bit about the reason why she is championing this initiative and the message that she wants to get across.
So the walk is at Hevelin Peak in the Lake District. My father walked there with his parents and his sister when he was a young child. He wanted to do the same thing with me, so I thought, which better way to combine something that's dear to my dad's heart with something that's dear to my heart. So I chose to sponsor for the charity Mental Health Foundation to help promote mental health in maritime, yachting industry, and also on shore. Because I think that mental health should be able to be talked about like as easy as you putting your lipstick on in the morning, or when you're brushing your teeth, getting dressed. And if you don't have mental health, it coincides with physical health. So you would see both deteriorate if normally one goes, the other goes at the same time. So I think mental health is just as important to be able to speak about, like you had a cough or a cold with your physical health. So I hope to raise as much money as possible.
Fantastic.
No limit.
Yeah, so in terms of how people can find you, if they want to contribute directly to the foundation or your fundraiser, how can they do that?
I will give you the link for the Just Giving page, and I can also give you my email address also.
Okay.
To put in the chat.
That would be wonderful. But we hope to see you at the webinar as well, because education is power and it can change everything. Yeah. Well,
I've already booked my ticket.
I know you have. You are the most generous person out there. I need to tell everyone, but Samantha just has a heart of gold, and she just keeps on giving. And she even gives back to her own charity. I saw Samantha's payment come through, and I was like, this woman is absolutely incredible. She's giving back, she's leading by example, giving back to her own charity, and she's a member of my membership, and the members don't need to buy a ticket, but herself and another one of our members, Jackie, has donated to the event and the charity. And I think that's just so beautiful. And not only that, but Samantha has bought counseling sessions with myself for her fellow friends or crew members, and that is such a beautiful gift. So thank you.
Thank you.
You're leaving a legacy, Samantha. You should be very proud of yourself. Okay.
I am.
Yeah. Well done. Well done. And I look forward to seeing you on Thursday at the webinar.
See you then. Have a great week.
Thank you.